Hello, good afternoon, and welcome to the ROI of FRCs, a strategic approach to preventing child welfare involvement. In this 90-minute webinar, we will explore the return on investment of family resource centers, share key research findings on their outcomes, talk about their cost savings, and discuss funding opportunities. I am joined today with Dr. Peter Pecora, Managing Director of Research Services at Casey Family Programs, and Janica Lockhart, Senior Vice President of Strategy and Impact at Akin, and I'm Brenda McChesney, Co-founder and Co-Executive Director of the National Family Support Network. Just a few housekeeping issues. If you're joining us online, you may listen directly through your computer speakers. If you joined via phone number that Zoom provided, your line has been muted to minimize background noise. For those of you online, please note that the link to the Dropbox folder is in the chat. And here you'll see some of the handouts that will be referenced during today's webinar that are available to download. In addition, you can put questions into the question section at any time. The chat section is also open for you to include any comments during the webinar. But note this, please. We ask that you put all questions in the Q&A section of Zoom, so that way either live tech support can answer any that might be tech issues, or when we go to our Q&A sections, we can answer your questions one by one. And if you do have any tech issues, you're welcome to reach out to Felipe, who's online, put him in the chat, and we'll make sure to get it worked out for you. And last note, today's PowerPoint, handouts, and the recording of the webinar will be available on our website on the Webinar Wednesday page this time tomorrow. We ask for you to take a moment at the very end to fill out our survey that will automatically appear on the screen when you exit out from the webinar. It gives us great, valuable feedback and helps frame the future webinars that we have to offer. With that being said, let's take a look at what we'll be talking about today. So our webinar today will include a little bit about the National Family Support Network, provide some Family Resource Center overview, basic information to make sure we're all level set on what is an FRC, what does it look like, how does it serve families and communities. And then Dr. Peter Pecora will take us into the outcomes that have been found in research and analysis around FRCs, the meta-analysis, and the cost-benefit information related to Family Resource Centers. We'll explore a little bit about funding for FRCs, including various federal and state funding sources, how they're blended and braided, and talk a little bit about how FRCs can tap into Title IV, B, and E funds. And then we'll turn it on over to the Washington FRC Network with Janica Lockhart, who will talk about the inception story of their network and the advancement of FRCs in their state. And we'll end with a Q&A group discussion at the end. So I believe, really quick, Felipe, do we have the questions to get a sense of who is here in the room to pop up before we start with NFSN overview? Fantastic. Here is the very first one. So we love to know, where are you joining us from today? Are you coming in from the Northeast, the South, Midwest, West? Are you north of us in Canada, or might you be representing another country internationally? So please take a second to select where you're joining us from, and we'll show you the results here in just a moment. All right, let's close that out. And the results. It looks like we have a big contingency in the West. Two of the three speakers are in the West. Actually, I'm also in Colorado, so we have a large contingency today. And it looks like a pretty good split between the Midwest and the Northeast and the South. Awesome. Thank you so much. Our next question is, what's your affiliation? Are you joining us today from a family resource center, an FRC network, an other family support program? Perhaps you're a parent leader or an early care and education, or you represent a government department or a private funder, or maybe you're just not on the list. If you are, click other, and let's see where you're joining us from. All right, we'll close out this next poll. And the results, we have 33% of folks who are family resource centers and 23 who are representing family resource center networks. So just over 50% come from the FRC space. And looks like we have other family support programs and some government official representatives, almost 20%. We're so happy to have you here. 6% funders and 10% other. If you are other and you want to pop in the chat of where you're coming from, what type of work you do, we'd love to know about it. All right. And our last question today is really just to understand how familiar are you with family resource centers? So that should have said centers, but you know what we're asking. So how familiar are you with family resource centers? Are you not familiar, somewhat familiar, familiar, or very familiar? And we can go ahead and close that out. All right. We have quite a bit of familiarity. So 40% very familiar, 26% familiar, and 33% somewhat familiar. So the information that we'll share today will be somewhat familiar to you also. We'll cover some basic context and then go deep into the research. We appreciate you giving a sense of who's in the room today as we explore this topic. Excellent. So how about we start with a little bit about the National Family Support Network. Over the last decade, we've actually quadrupled in size to now have 38 member networks, which represent 38 states plus the District of Columbia. That's more than 3,000 family resource centers that's represented throughout our network, and they serve more than 2 million people annually. The newest members are Oregon, who joined early in 2025, and Missouri, who joined in May. Our mission is to promote the positive outcome for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. And our vision is that all families in all communities will be able to have access to quality family support services provided by FRCs that are supported by strong statewide networks. And our work breaks into three buckets. One bucket is our connecting and convening member networks to enhance their effectiveness. Our second area of work is promoting family support best practices and evaluation. And this is really done through the standards of quality for family strengthening and support, where we define and help create a common language, standards, and evaluation for local and national implementation. And the third is raising the visibility about the value and the impact of family strengthening and support networks. So now that we've talked a little bit about the NFSN, let's dive into FRCs. So as many of you know, a family resource center is a community or school-based welcoming hub of supports, services, and opportunities designed to support families to be strong and successful. They may be community-based, like the image on the left of the Family Resource Center that you see in Vermont, or they may be school-based, like the image you see on the right from Kentucky. They may be in rural settings like you see on the image from here in Colorado on the left, or in urban settings like the image you see on the right of family resource centers in the Bronx and New York City. Wherever they are, FRCs work with families in an approach that is not only two-gen, but multi-generational, strengths-based, and family-centered. FRCs and family support work is really the OG of two-gen work and multi-generational work, as these programs work with children, parents, and grandparents as well. And they build strengths because we see families as having strengths that we want to support them in building upon. And of course, family centered because everything we do has families at the center of our work. What's really special and important to note is that these programs, family resource centers, are designed for all families, not only low income or highly challenged ones, because the support that they provide is non-stigmatizing, making it more readily accessible to any family in any community. Program is provided at no cost or low cost for participants. In fact, you see the image here on the right is from a family success center in New Jersey. And there are 57 family success centers in New Jersey across the state's 21 counties. That means that for every one county, there is at least one family resource or family success center. And that includes highly affluent communities as well as highly challenged communities. Because again, the belief is that all families can benefit from access to supports for two of the most important roles that we have as adults, being parents and being spouses or partners, and two of the most important roles that we can have for which we typically receive no support or training, hence the value of universal access to family resource centers. So let's see a pop in the chat. If you have heard of the Strengthening Families Protective Factors before, please put an emoji in there. Let us know how familiar are you with the Strengthening Families Protective Factors. I'm seeing hearts and thumbs, double thumbs up, clappy clap. Thank you, Kaylin O'Connor. Great to have you here. Yes, the strengthening family protective factors are fundamental within the world of family support and family resource centers. They come from the Center for the Study of Social Policy. Research has shown that these five protective factors increase family stability, enhance child development, and reduce child abuse and neglect. So, as we're working with families, we want to support them to build these protective factors because we know that they make a positive difference. The five protective factors are parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, social and emotional competence of children. And if you'd like to know more about them, you can visit the CSSP website down at the bottom here and click for more information. So simply put, FRCs are just a good idea. They're cost effective. They're highly adaptable for various communities, be they urban, rural, or ethnic, and have demonstrated successful outcomes through multiple external evaluations that Dr. Pecora will be walking us through later this afternoon on our webinar. And family resource centers, as conveniently co-located hubs, they bundle and co-locate many services that may be familiar to you, such as home visitation, evidence-based parenting programs, health screenings, playgroups, fatherhood programs, family counseling, and food banks, along with an array of additional services. FRCs are shaped by and responsive to their communities. They often have staff who are hired that represent and share the lived experience of families served and have formal opportunities for families to influence and help co-design programs through parent advisory committees. Despite their organic development and the varied funding streams across the country, there's remarkable similarity in the most common core services. These are the top four based on the research that was funded by the Robert Wood Johnson Foundation, done in conjunction with the Omni Institute in 2016. So the most common services areas, number one, parenting support, which exists on a continuum from lighter touch to more intensive services. Lighter touch being parenting workshops, and then parenting support groups, all the way up to home visitation services and programs. The second highest, most common is access to resources, which also exists on a continuum from lighter touch to more intensive services, which lighter touch being enhanced information and referral, and the higher touch being co-location of resources for families so that they're not navigating across town or across multiple communities in order to get the supports that they need when they need them. The third is activities focused on supporting children's healthy development. And the fourth are activities supporting parent leadership development, such as parent advisory committees. And FRCs not only provide programs, but they build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse and neglect. So now I have the honor to turn it on over to Peter Pecora, who will take us through the FRC outcomes, the meta-analysis, and cost benefits of family resource centers. Peter, on to you.
Thank you, Brenda. Thank you, folks, for investing the time with us today. This slide is going to just provide some overview of the kinds of areas that family resource centers have been able to have an impact in. You know, when we started one in a little neighborhood in Bayview, Wisconsin, umpteen years ago, our impact areas were very modest. It was trying to network the community, connect both children and some of the adults in the neighborhood with local resources, and sort of and it was sort of our attempt to bring services to a neighborhood that was very well neglected by a lot of government agencies. And I think some of the services and organizations that Brenda's been sharing with you, I think fit that mold. And then we've got, you know, as she mentioned, it ranges to the very, very more sophisticated, more comprehensively funded centers that really provide a wide array of services. So, you know, we just want to acknowledge today that there is a wide range of services. There happens to be a core set of services now that have been emerging in the last, 10 years that weren't available. I don't think we had the models and the kinds of support that we have today when I first started that work in the 80s. Actually, it was the mid 70s. But what we are starting to find is that depending upon, again, the emphasis and the services of that resource center, it really, they really can help make an impact on areas like helping families get connected with the right public assistance services. Um, for example, Magnolia Place in Los Angeles until recently, and may still do that today. A couple of days a week, the TANF staff person would have a little office set up where families could drop in and apply for TANF benefits right in the Magnolia Place office building. And that's an example of, you might have that in a resource center that you're working with, or you might have an outreach worker there that really can help connect families with the kinds of public assistance, housing, and other services they need. And so what we're finding is that in a number of the resource centers, we've been able to measure that, in fact, they are strengthening parenting skills. Parents are reporting they're feeling less socially isolated. We do have data, which I'll show you, that help drive some of the return on investment analyses that we've been doing. And the data that tend to drive those analyses that are monetizable, as they say, in the economic world, are preventing the recurrence of child maltreatment reports, either reported or substantiated, or reports, accepted reports, or substantiated reports to CPS. And the other area, outcome area that has been a very good variable to measure in terms of our cost effectiveness studies has been to the extent to which the services that family resource centers provide can help decrease the likelihood that a child would be placed in out-of-home care. And so I want to highlight those because you'll see, you may not, it may be embedded in some of the slides, but I want to lift up that two of the main outcomes that are deriving some of these more recent cost effectiveness studies have been reports to Child Protective Services and the prevention of out-of-home placement. We can go on the next slide. That was just probably an overview. Now, I know this slide is hard to read, and that's why you've been provided a link to the PowerPoint deck and some other excellent resources that Brenda has found has been very valuable for people. But what I love about this table is it tries to help us understand that really family resource centers not only can be an incredible support for families in terms of a upstream primary prevention, health promotion kind of an area of focus, all the way through helping families who might be referred to them as part of a differential response program at the public child welfare agencies, where they're saying, hey, this family has been reported to us, and we really don't think they merit an active safety plan, may not even merit a CPS investigation, but the family really deserves and could use some support. Let's turn to our local family resource center for that. So that's why you see that differential response column in there. Family resource centers also have been helpful for open child welfare cases. So you've got a situation where kinship care foster parent needs some support, or a birth parent has their child with them. They're receiving services from a variety of agencies, and they really happen to enjoy the parent support programs or the parent training programs that might be available to them through their local family resource center, because they tend to be neighborhood based and not housed in a large bureaucratic building, unlike what a lot of public child welfare agencies are. So that's why the open child welfare case column is there, and I think there have been some beginning strides to try to help family resource centers tap into some of the family first prevention dollars across this. I know we're going to get into this a little later, but I do want to highlight that there are samples of what funding streams might be available for various areas of FRC work there at that second to the bottom row. And we'll have some better slides on this, the funding aspects a little later for you, but just did want to call that out. And also from a post reunification, nearly 1 in 5 children, unfortunately, are replaced, re-reported and replaced in foster care in the United States. That does vary by state. Some states are do a much better job of trying to prevent foster placement reoccurrence, but to help provide those very important post-permanency services to prevent foster care replacement, that's another area of family resource centers can be a real support to families as they move ahead with their lives and they have their children returned to them. So anyways, the table is very good, I think, in sort of showing the potential areas that a family resource center might work in, along with what is the public child welfare agency's role and then what types of funding, even though we're going to go into a little more detail on that funding piece. So let's talk about cost savings. One of the early pioneers in this area was Alabama. I just love the fact that they were one of the first states to really think about this. And yes, it wasn't the fanciest cost benefit study. No, they weren't able to do a randomized control trial design, but the state really took a thoughtful approach at what type of benefits they were getting. And they estimated that for every dollar they invested, they received $4.93 in immediate and long-term financial benefits. And they calculated that by looking at the kinds of major programs that they were delivering through most or all of their family resource centers, and which were the ones that you'll see Brenda and Danica, we'll talk about all the way through this presentation: parenting, education, and support. Increasingly, a number of them are providing fatherhood support programs. And some of the FRC centers have now become sponsors or hosts or vehicles by which people can access home visitation services. So very important piece of work. They did highlight in their study that they thought their parenting programs had from their analysis, had the greatest fiscal impact, in that they made about a $2.1 million investment at that particular years, and then they estimated $29 million in returns. So very early study. It's always nice to see a state pushing ahead. There's been 2 more recent studies that we wanted to highlight for you today. And one was we at Casey Family Programs we teamed up with Orange County, and they have a long-standing network of about 15 family resource centers in Orange County, California. And we actually did a study of all of those resource centers, and then we used a geographic comparison group based on some work that Bridget Leary and Fred Wolshin had done in Allegheny County, Pennsylvania. Very good study they did there. And we used basically that methodology because, as many of the folks on the call know, you can't do a randomized control style study in family resource centers. You really have to look at, are there differences in family and child outcomes in the neighborhoods that are served by a family resource center compared to the neighborhoods that are not served by a family resource center. Because, as you know, many of the families that are served by family resource centers don't want to provide a lot of demographic information. They want to show up, get the services, get what they need, and they really don't want to be part of an in-depth study per se. And so we've got to use some of these more creative ways to use geographic-based comparison groups. So what we did for the cost-benefit study is that Omni Institute, built on what Catherine Roller White and Orange County were able to do, and Omni Institute zeroed in on the Westminster area, and we did a cost-benefit study of that, a return on investment study. And then what we found, bottom line, is for every dollar that Orange County invested in family resource center services in Westminster area, the county saved $3.65. And so that was our way. Again, it was fewer reports to Child Protective Services was the primary outcome that showed a difference there. And so that was a study we were able to do with the help of a very innovative public child welfare agency there in Orange County had allowed us to do that. Moving eastward into a more rural setting, I really, this has been, we were very fortunate that Teller County, Colorado, not a large urban metropolis, not funded in some huge way, but there you have a county agency and the community that really banded together, and they've been trying to provide an array of services through a family resource center there in largely a rural area in Colorado. And again, Omni Institute we used the same technology that was pioneered in Allegheny County, Pennsylvania, and we found that we could attribute about 51 fewer reports of child abuse and neglect in 2018 when the resource center was operating really at a more full level compared to 2015. In this case, because there were areas that were distinctly not served by the Family Resource Center, we did attribute, and they are one of the main providers of services in that area. We estimated that for every dollar invested, the county saved $2.92. And so now by the way, the methodology and a little bit more about the program for both Westminster and the Teller County studies have now been published in two separate issues of what is called the Family Justice Journal. That's an open source, free to anyone journal that you might want to access. They publish a wide array of articles and have done two separate articles, one on each of these. So we wanted to give you the good news there that at least, in different areas, Allegheny County, Pennsylvania, Alabama, Westminster County and in California, and in Teller County, Colorado, we now have data. And actually, Brennan will put up our sort of summary slide for the two most recent studies for you that really show that these are a good investment of taxpayer dollars. Just the drill down, I skipped this one, I should say here. In Colorado, that drill down on the various services, those are the kinds of services they think we're making a difference on that next slide. I should mention that. Yeah, they demonstrated statistically significant improvements around the families were benefiting from an economic self-sufficiency point of view. That center says that they really have helped families make an impact on their health. They do provide concrete support, as the families need that, and that usually takes the shape of the form of clothing, food, housing assistance in terms of referrals. So those are some of what we call concrete supports that generally people are getting through the family resource centers, along with, through the various parenting services they provide. You're helping these families sort of build up their functioning, gain some resiliency back in their lives, and then they're a better, nurturing caregiver to their children. So those are some of the things that the Teller County people wanted us to make sure we mention that were some of the core of their program. So again, here's the summary. Oh, of the Kentucky one. Yes, here's my final slide. We are hoping, I didn't really realize, we talk about family resource centers as sort of America's best kept secret. Here's an example of that. Up until a couple of years ago, I was not aware that Kentucky had this vast array of family resource centers. And not only do they have a vast array of family resource centers in a state that's pretty fiscally conservative, but they've chosen to locate those staff or the couple of staff in as part of schools. So they have their primary model that they use are school-based family resource centers. We haven't seen much research on this type of an approach, and they credit the work of the family resource centers and some other innovations in Kentucky with helping them move from being a ranking of 45th in place, and I don't know the exact criteria they were using in the ranking, but it was for ranking in quality of schools from 45th place in 1990 to now they're in about the top 15 school systems in the country. Now, we're going to dig into this a little bit more, but that was quite an accomplishment. And we're hoping to do a return on investment study with the Kentucky school-based family resource centers being compared to other areas in Kentucky that don't have that, and with another comparison state. And we're trying to talk with a couple states now to lock that study in. So I just wanted to mention and call out what we hope will be our next return on investment study on a very unique system that has not received much evaluation attention. That is school-based family resource centers. And I think, Brenda and Jenna, we're going to stop here for questions on anything that that Brenda's covered or I have covered so far, and give you all a chance to weigh in, and we'll look at the chat to see what those might be.
Peter, the first question that came in is from Margaret, and she said, I've asked our county social services a few times for data on case reoccurrence after referrals have received parenting support, but have not gotten a response. Is there another source of info, maybe at the state level for North Carolina?
I, if this person wouldn't mind emailing me, and I will put in the chat my email address in a minute. I would be happy to connect you with the state strategic consultant for North Carolina, which is Ralph Baird, and we'll get a conversation going, because we really have figured out very cost-effective, non-intrusive ways to measure these kinds of outcomes that the public child welfare agencies have found fairly manageable to partner up to do. And so I would be happy to help this person make the right connections and see if we can help you get that data.
Thank you, Peter, for being such a great resource in that way. We have another question from Holly McPhail, who says, I believe this came in at the first or second research study that you mentioned. How do they measure these changes? Use of the protective factor survey? Question mark.
Oh, Brenna, Jenica, could you guys talk to a little bit about what are the types of family functioning and other scales that family resource centers have typically used in your work? I think it would be good to hear from you. I know the protective factor scale, and there's two versions of that, have been very helpful and been used over the years. And they're really great when you use them in a pre-post method, or it comes out of nursing and some other areas. If you can't catch the family at the beginning, there's a method that we've used in research called the post-then approach. And that's where you have the parent fill out the scale twice. And the first time they fill it out, they say, here's where I am now in relation to whatever functioning on that, if it's the CANS or the family functioning support scale or whatever scale you're using. Then they say, what was I like at the start of my services? And they do a rating that's called the then. What was I like then? And that way you're able to get a form of a pre-post kind of a measurement when you're talking to that family member at the end of the service. So I mentioned that. Sounds like a technicality. Folks can write me for that if they want to use that for their program, but that's one way to go at it. But to answer the main question that was posed, maybe I'll turn back to you all.
Yeah, and she did do a follow-up. Thank you for clarifying that. Holly was saying specifically regarding in Teller County, the Family Pathways and CFSA 2.0 evaluation. So it's been some time since I was the director of Strengthening Families programs in Colorado, where we created the CFSA 1.0 and the 2.0 and the Family Pathways. But to answer your question, the protective factor survey is included in the Family Pathways and CFSA assessment and evaluation process. They also do a full assessment across 14 domains, which assess family stability, self-reliance, including income, housing, food security, transportation, and health coverage. Of course, the protective factor survey, and then they also include in the CFSA 2.0 a readiness for change. And so this is where families identify up to 3 areas that they would like to set goals and make changes. And then the CFSA and 2.0 and family pathways then tracks their progress toward those goals and really ties all their family support services and information resource and referral around those goals to help the family further progress along that spectrum. So that's one more detailed example. And Colorado is known to have one of the most advanced evaluation and data system platforms for family support work, especially the formerly called case management, right? Family development work, where you're working with the family, leveraging their strengths, working with their goals and their hopes for their family to achieve the outcomes that they hope to do. And Janica, because you're on the call too, I'm Washington. Is there a specific tool or measurement that you'd like to mention?
Well, there is one that I'm really aware of, and it's called mobility mentoring. It's out of Empath. They have a tool called the Bridge to Self-Sufficiency. It's open sourced if you want to go to their website and look at it. And the goal of that is family stability, moving families out. It actually Empath original focus was helping women who were homeless with families, and so the bridge has been demonstrated to move families out of poverty and actually out of homelessness. The other one that I'm less familiar with, that's actually based out of Washington, started here. It's out of an organization called the Prosperity Agenda. I know the Alabama Family Support Network uses it and has seen real success. Again, when we think about like economic mobility with families and transitions out of homelessness. So those are some of the other tools that I've seen that have been very successful out there. In addition, I want to emphasize Brenda with the Colorado 2.0 assessment, and is actually an EBP that is in the California Clearinghouse. So just want to note that as well.
Yeah, thank you for making that important addition. That happened in the last 12 months, which was a fantastic next move toward FRCs and family support work having validation within the evidence-based models. So we have another question, Peter, that's come in from Robin Bowen. And Robin says, is there any data regarding homeless families, such as preventing homelessness or helping to keep families in a home and or navigating to housing?
I'm not aware of any. I think it's a brilliant question in an area. You talk about the unsung heroes that help every day, and there are a ton of success stories in that area. That's a story that's worth telling, and an outcome worth measuring.
And I do know that the CFSA 2.0 that we were just talking about has multiple domains around economic sustainability and housing being one of them. So the data that's come out of the Colorado model has tracked housing and housing outcomes as it relates to overall family stability. Janica, off the top of your head, being in Washington, do you have any other reference points that would be helpful for Robin?
Yeah, just the two that I mentioned around mobility mentoring and the prosperity agenda model. Those are the other two that I'm aware of out there in that space. I haven't seen, besides the Colorado 2.0 assessment, I haven't seen any that have been directly tied to an FRC. I'm suspecting our friends in Alabama, though, have some of that information, but not off the top of my head.
Thanks, Janica. Next question is from Sid Gardner. Do current data systems and FRCs enable them to continue to document their savings benefits after these one-time studies have been done? Do costs of FRCs include that kind of continuing data system to prove benefits as a defense against spending cuts?
No, it would be wonderful if they did. I mean, we have developed with Omni, and they pulled it from some of the mainstream economics work. We do have this formula for how to calculate that. But to Dr. Gunner's point, that is, it takes some calculations, and then you have to go pull that data. You have to estimate, what's the average cost of a CPS report, or what is the average cost per day of having a child in foster care, and then do the calculations and do the measurements of what you think, how many children have been reported or how many children have replaced in your comparison group areas. So it's almost like we have to periodically repeat these studies. Now, you would hope, though, that policymakers and legislators would start to get it, that they would, you know, maybe may say, hey, we just did this study, or Colorado, a state over, just did this study. It's unfortunate that we have to keep re-educating people, but I don't see a way around that. In fact, the MIS systems are a pain point, right, for many family resource centers, and getting information systems that talk to each other, that are easy and affordable for family resource centers, and then that can be linked up to the public child welfare agencies is I think Dr. Gunner is pointing out a very important area of challenge and ongoing work. So
Yeah.
we're not there yet, but I sure hope we are in a little better place in the years to come.
Agreed. And one of the investments that we did at the NFSN over this last year, and that concluded at the end of the year in 24, was to do a national assessment and analysis of all database systems used by FRCs or FRC networks to understand what are the common areas of data gathering, what would be recommended, what is the cost of each of these systems, how easily are they adapted and built out to the unique needs at a statewide level or a multi FRC level versus one FRC. And highs and lows of knowing numbers, right? The high is that we can do something about it. We have roughly 53% of all state networks and their FRCs were using database systems. Now, some were using Excel spreadsheets. That's better than a piece of paper and tally marks. But we know that the nonprofit sector and family support sector has a long way to come. But we're right there now, having the power in our hands. And through this report that can be found on our website, and since I've mentioned it, I'll make sure to find it and drop it in the link here. It's a full analysis of the top use systems and then the committee that we put together of over 12 different representatives across the country, of different state networks who employ evaluation and evidence and systems to track their outcomes, did a ranking of each of the database systems based upon 52 different indicators to come up with the top recommended systems for family resource centers. So we invite you to look through that and explore each of the systems that was used. And really building this into your budget as a baseline expense is something that at a national scale, we are encouraging and inviting everyone to do. Additionally, we're in the process of building upon the momentum of the win of the federal definition and statutory federal definition of family resource centers that happened in the fall of last year. We're now in the process of developing out a full FRC model. So the baseline of what is a family resource center and a fidelity checklist that goes along with that. And with that, not only are the guiding principles and philosophies that are different, that make FRCs different than any other family support organization, but it also will come with the key recommendations for best practices, which include having database systems that you can track and begin to tell a story. Because we can't even get to the ROI piece of data if we don't have good systems to track and see the progress and celebrate the progress and the success of the families that we're working with. We could talk forever about this as a whole collective of panelists here, but let's go on to the next question.
Yeah.
All right. We have one from First Five Contra Costa, back where I used to live growing up. Mackenzie says, in the absence of impact studies from our own FRC, how do we feel about borrowing impact estimates from other studies to conduct our own ROI studies for our own unique centers? Peter, you want to jump on this one first?
I did reply to Dr. Whips already in
Okay,
the chat, so we're good there, hopefully. And my
fantastic.
email is in the chat now, so
Awesome.
I'd be happy to talk with her about that.
And I'll just piggyback on that we have state networks and FRCs all across the country telling the story about this research that's been done and using it as a justification for the significance and the importance and the impact that FRCs make, as well for the funding that folks should pour into you for being able to track your own data outcomes and be able to do your own ROI study. So we invite you to put it on your website, in your social media, in your annual reports. The link also, like the best synthesized document that is not an NFSN document that exists, in my humble opinion, is the one that Casey put together on what you need to know about FRCs. The link has been dropped in this chat. Felipe, if you can drop it again. They updated it in October of 2024, and it is the most synthesized list of all the data, the research, the outcomes that you can find on FRCs in one single location. So if you're not the marketing person at your organization, make sure that your board and your marketing person get this to be able to leverage it to tell the story of our incredible work and our impact across the country. I'll get off that high horse. Next one. Is there more information on how FRCs are structured under a school-based system? So one answer there, Beatrice, we've had numerous webinar Wednesdays. At the end, we will give you the link to how to go find the past webinar Wednesdays, but we've featured multiple school-based models, Kentucky being the largest. They have over 1,000 school-based family resource centers in the country. We have webinars that have featured school-based FRCs, and I believe we also have downloadable materials in our resource list on the structure of school-based FRCs. If Beatrice, if you wanted to email me, I'm happy to put you in touch with, we have Hawaii school-based FRCs, Connecticut school-based FRCs. I could go on and on and on and name the list. Kentucky certainly isn't the only one, but we're also happy to put you in touch with folks if you'd like to learn more. We'd love to see a link to that report. Yes, reports they're in the Dropbox. And for those who can't access the Dropbox, you can email Felipe at nationalfamilysupportnetwork.org to be able to get the documents directly. I know, Janica, you've been watching this, and I feel like I saw other questions come in that weren't in our Q&A chat. Did you see any others?
No, some were duplicate of what was in the Q&A, Brenda, and people reposted also in the chat. I didn't see any additions, and apologies all if I missed something.
I actually see one here
Okay, great.
in the webinar chat from Marianne Scheel. Sorry for butchering that word, your last name. How have the executive orders affected the families that were being served but might not be able to be served because it would be a violation of the executive orders? Curious, Janica, with you overseeing a statewide network, if there is anything that you would like to share.
Yeah, so I mean, our approach is Brenda has been sharing is FRCs are open, welcome to all. We do not ask status information. When we do assessments with families, it's looking at the challenges they're facing and addressing immediate needs. I think for when we think about our FRCs in the state of Washington, we're kind of waiting and seeing what is going to happen in this space. It's early on. I think it's important that we don't take an immediate action and what that means. So we're just navigating it day by day. I know that is really difficult currently in this political climate, and every organization has to view these things differently. One thing about running the network is which I'll be talking about soon, is we have 7 FRCs in my organization, Akin. There's 100 FRCs in the Washington Family Support Network. And those individuals, FRCs, make their own decisions around these things. And that is the FRC way. They're independent, they're community-based. And I think their approach on handling these things is variable, not just in Washington State, but I imagine also all over the country. So.
Thank you so much, Janica.
Yeah, no problem.
All right. I believe that we have covered all the questions that have come in, which is fantastic. So let me gear up the webinar. Now, as you have more questions that come in, please feel free to put them in the chat. We're going to have one more section at the end to dive into the Q&A of what we're covering next. So 1 second. All right. So now on to talking about what does it cost to run a family resource center? So it's funny that there was a saying for a really long time, and you even heard Peter mention it. When you've seen one FRC, you've seen one FRC. And that comes from the place that FRCs are community-based, right? They are developed of, by, and for the community. And what one community needs in a small rural Colorado may be very different than what a community needs in Hawaii or in New Jersey. So that's where you see a lot of variation. And the same is true for when we talk about what does it cost to run a family resource center. All of that being said, that we're finally beginning to have a national dialogue around a definition of FRCs, an FRC model, and being able to put some concrete tools toward launching FRCs in the hands of folks who are interested in growing FRCs across the country. So as we look at the varying costs that have to do with cost of living, specific programming, like how many programs do you offer in-house, how many do you co-locate or do in collaboration with other organizations, as well as the physical needs, that's where the variability comes in with what does it cost to run a family resource center. So as you see here, a typical family success center in New Jersey has an annual budget of $240,000 to $300,000 a year with 3 to 4 full-time staff. But in Kentucky, that has the annual budgets per FRC location are $50,000 to $95,000, and that includes 1 to 2 full-time staff and the space and other resources that are provided in kind because they're school-based, right? So they have the rooms donated through the school and other resources that they work to support their family often are provided by the school, so they can significantly cut down on costs through their school-based model. So the funding that goes to support FRCs really varies, but mostly we could say that it's by state, county, and municipal governments. Some leverage federal funding, such as CBCAP dollars, which we'll get more into the federal funding landscape in a moment. And others leverage foundations, corporations, individual donors, and in-kind support. So in 2024, the NFSN launched a new federal funding for FRCs overview, and it highlighted the federal funding sources that have been used to start up new FRCs and enhance the work of existing FRCs. So when thinking about a new FRC, the data that was reported back by the state networks across the country reported 4 core sources of federal funding for new FRCs. That includes community-based child abuse prevention funds, CBCAP, community collaborations to strengthen and preserve families, preschool development birth grant through 5, the PDGB5. I'm dyslexic and that one gets me every single time. And the last one are the Title IV-B dollars, including promoting safe and stable families. So that's the snapshot of new FRCs. But when we turn the page and we look a little bit deeper at existing family resource centers, the list of federal funding streams that have been used to enhance the work expands a bit. So here you'll see we have the Community Services Block Grant, Early Head Start funds, MCV funds, Maternal, Infant, and Early Childhood Home Visitation Program. We also have that Preschool Development Grant, Birth Through 5. Also Social Services Block Grant, Supplemental Nutritional Assistance and Program Employment and Training, TANF dollars, Title IV-B Kinship Navigator dollars, as well as Workforce Innovation and Opportunity Act funding. So if you're interested in accessing this downloadable resource, I'm going to give you a second to take out your phones and you can scan this QR code. It's also on our website. And Felipe, I'm also wondering if we can go ahead and add this to the Dropbox link, pretty please, that folks can use to download. So this is the 2024 Federal Funding Overview for Family Resource Centers. And this is a comprehensive list not only by each federal funding source, so we break it down by federal funding. So if you go to CBCAP, you can then look at an alpha order list of every state, like on this image on the screen, that leverages CBCAP dollars at the network or FRC level with the contact information. And then we also did it by state. So you can go to California and be able to see all the various funding sources that California leverages to fund their state network and or their family resource centers. This gets updated every 2 years. Now, when we look at Title IV-B reauthorization, we have new opportunities for funding a broad range of opportunities that are done within the Family Resource Center context. What's really exciting is that FRCs were named as a source to be able to draw down these funds in the recent reauthorization. And under the new legislation, FRCs can be considered for federal funding under several key categories. Family support services, which include providing resources and assistance to strengthen family functions. FRCs can also draw down for family preservation services aimed at keeping families together and preventing the need for foster care. Family reunification services, which assist reuniting the family separated by foster care or other circumstances. Adoption promotion and support services, supporting the adoption process and ongoing needs of adoptive families. And of course, it's essential that the funding aligns with the purpose of the selected category, ensuring that the resources are used effectively to support the intended outcomes. Additionally, it outlines flexible application of funds. So a flexible application approach was introduced, which broadened the potential use of funds, including the allocation toward FRCs. And last to note around state discretion over funding, that while the majority of promoting safe and stable families, which is PSSF, funds are mandatory, states retain very significant discretion over the allocation of these funds, which means that states can decide whether to direct these funds toward FRCs based upon localized needs and priorities. So a little bit about Title IV-B in action. So, when the reauthorization came out, we said, okay, who across the country is leveraging Title IV-B funds either at the state network level or at the FRC level? And we got back a decent amount of data. What we found is both Arizona and California are using the legislation as a rationale for larger budgets and expanding funding and service requests in child welfare and prevention services. In Kansas, they're using it to assist with funding 10 FRC sites that were done in 2022. In Minnesota, they're exploring funding opportunities with plans developing post-approval for their state plan. In Oregon, they're using it to build on legislative momentum to enhance funding strategies. And in Washington, they're managing community care funds awaiting further legislative support. So now over to Title IV-E, key components. So the Title IV-E of the Social Security Act provides federal funding for foster care, adoption assistance, guardianship assistance, and prevention services. It's designed to ensure the safety, permanency, and well-being of children in the child welfare system. The key components as it relates to this conversation of Title IV-E include Title IV-E foster care program and the Title IV-E prevention services. So this is the Families First Prevention Services Act, FFPSA, another one that will get you if you have dyslexia. And that funds evidence-based programs that help keep children out of foster care by supporting families in crisis. So let's break this down just a little bit. I know this is a lot of information, and this is in the PowerPoint that's in the Dropbox that we provided. So under foster care maintenance programs, the payments support the daily expenses of eligible children in foster care and cover food, clothing, shelter, daily supervision, school supplies, personal incidentals, liability insurance, reasonable travel. For administration activities, and this is where there's a really interesting opportunity for FRCs, and we'll be doing a webinar specifically focused on this in Q4, which will be looking at federal funding streams, how to blend and braid and access Title IV-B and E funding with examples in multiple states. So under administrative activities, federal financial participation, FFP, is available at a 50% match rate for administrative functions necessary for the proper and effective administration of Title IV-E, including eligibility determination and redetermination. So this is the time that it takes to assess and reassess a child's eligibility for Title IV-E benefits. Referral to services. So the referrals that are directing children and families to the appropriate services, a key fundamental part of FRCs is that information, resource, and referral. Additionally, development of a case plan. So creating plans outlining services and goals for the child and the family. Again, mentioned from the Colorado Family Support Assessment of that goal setting framework of identifying what the family's plan and goals are and helping them to achieve it. Also, case reviews and case management and supervision. We like to call it family development work, but we all know case management is really ultimately the overseeing and the coordinating of services for the child and the family. And then also to note here is data collection and reporting. So gathering and submitting required data for federal data reporting. The third area is around training activities. So there's funding available at a 75% match rate for training activities related to the administration of Title IV-E programming. And that includes training for personnel, so that's your staff, training for foster and adoptive parents, and training for childcare institution staff. And it also covers adoption assistance payments and guardianship assistance payments. And when we look at Title IV-E in action across our network for state networks and FRCs, we found that in California, counties are creating specific models for Title IV-E funding through FRCs. In Iowa, they're engaging in dialogue with child welfare regarding the community plan under Title IV-E. In Kansas, they're using Title IV-E funds to support foster care children, showing a direct application in FRCs. In Louisiana, there's funding for kinship navigators as well as child welfare prevention programs. Minnesota, they had got a late approval estate plan, but they're exploring funding opportunities. We also see in Oklahoma that despite opportunities, the state has not utilized Title IV funds effectively yet, but they're hoping to do so soon. In Oregon, there's a strong partnership with Title IV agencies to draw down prevention dollars. And in Washington, there's collaboration with the Department of Children, Youth, and Families to explore funding options. So we have federal funding, state funding, Title IV, Title IV-B, all these funding sources. And we also know that there's additional support going in to new state investments in FRCs that are outside of those funding streams. And it's because we saw when COVID hit, there was such a strong response to support families through COVID that as organizations and schools shut down across the country, the one thing that remained open consistently were FRCs. And we went from having 50 to 75 people on webinars to having 400, 500, 600 people on webinars, state department officials, federal government officials, philanthropy, all across the country looking to FRCs to be the emergency response, but also the steady hand in helping families support their needs in communities across the country. And so in 2022 to present, we saw this huge influx of not only FRCs, new FRCs and FRC investments, but new state networks and network investments. So we saw investments in FRC network structure in Hawaii, North Carolina, and Texas. We saw deeper investments in FRCs in Georgia, Illinois, Indiana, Maryland, New Hampshire, New York City, New York State, Oklahoma, Utah, and West Virginia. We also saw new networks established in Minnesota, Nebraska, Wyoming, Iowa, Oregon, and Missouri. And first time ever investments in FRCs in Kansas, Michigan, South Carolina, Virginia, and Washington. Whew, you've heard a lot from me. It's a lot of data on why you should invest in FRCs, the outcome around FRCs, the various ways you can leverage money for FRCs and FRC networks. And we thought it would be fruitful to bring in an example of a state that has had incredible traction toward the development of not only FRCs, but their state network. They've incredible bipartisan support and philanthropic investment. They're an incredible example of how you can build a movement in a state and have it catch fire. So I am honored to introduce Janica Lockhart, turn it on over to her to talk about the Washington Family Support Network.
Oh, thank you so much, Brenda. Good afternoon, everyone. So I'm going to talk about the Washington Family Support Network. One thing I want to note is I'm with an organization called AKIN. It is a merged entity of Children's Home Study of Washington and Child Haven, merged about 18 months ago. So it may be a new name for those of you out there. We've been operating family resource centers for about 35 years in our organization, and they're located all over the state of Washington, from all the way over in Spokane to Southwest Washington. We have two in the community of Washougal in Vancouver, and then we have a couple in King County proper, and one in the city of Seattle. We were really fortunate in our journey around developing our FRC network. It happened about 4 years ago in the middle of the pandemic, where I had met with a partner of ours in Colorado. And I know you've all heard from Brenda about some of the stuff happening in Colorado, and obviously the study Peter talked about in Teller County. I got connected to the Colorado Family Support Network, as well as a public sector partner and a local FRC in Colorado, and started learning what is an FRC network or a family support network, and started discovering that we didn't have a statewide network in the state of Washington. We had some mini networks around the state of Washington, predominantly in Pierce County, Tacoma area. The city of Seattle was operating what I like to call a mini network, and Snohomish County, as well as school districts down in Southwest Washington. So we had pockets of this work happening, but not as a cohesive statewide network. Thanks to the folks in Colorado, I also got connected to the wonderful California network and the National Family Support Network. And we have really taken what has happened in other places around the country and used it in the state of Washington. So 4 years ago, we received a planning grant of about $250,000 to start developing the network. And what did the network want to be? And so the network created a mission statement, which is to build capacity, improve quality, and advocate on behalf of family resource centers and like-minded organizations to better support children, youth, and families in their community. And you can see on the right side our composition of FRCs. We have a good chunk of them are community-based FRCs. We also have the school-based FRCs predominantly in Southwest Washington, but we also have some supporters with government entities like our Department of Children, Youth, and Families, some county-based support, and also a parent trust in the state of Washington. And I'm going to get more into the funding sources here in a little bit because we've taken a very different strategy than I have seen in other states around the country in how we've been able to advocate for funding for FRCs. I also want to note that these numbers are a little bit old, but I'm happy to say we're actually up to 100 FRCs in the Washington Family Support Network currently. Next slide, please. So I think one of the key steps that we took as an organization in helping advance the network was creating a state definition. This allowed us to pursue future budget asks in the Washington State Legislature. The definition actually was taken a lot for mention Colorado and California's baseline definitions that already existed out there. And our Washington State FRC definition is a unified single point of entry where families, individuals, children, and youth and communities can obtain information and assessment of needs, referral to, or direct delivery of family services in a manner that is welcoming and strength-based. It is a broad definition because we really wanted to be inclusive of everything that FRCs are doing and really have been inclusive in the membership of the network, where it's open to any organization that wants to participate, that views itself as an FRC or would like to become an FRC, and providing that learning community and the training on the quality standards that the NFSN has been advancing have really become the baseline of the work of the network. And then on the right, you can see our various service areas. Out of those 100 FRCs, our FRCs are providing a diversity of services depending on their community and what their needs are in their community. At Akin, we have an FRC in Wenatchee as an example that does mental health outpatient services, has a WISE program, does immediate concrete goods and needs, and also has a school-based program. And so, but Wenatchee looks very different than a place like our Vancouver FRC that also does outpatient support, has an LGBTQ teen program, as well as immediate concrete supports and family navigation. So every single FRC that we have seen in the state of Washington all look different depending on the need and what is the funding that is available. I appreciate Brenda noting we have grown very, very rapidly, even to my surprise. When I say there's 100 FRCs, they are represented by 50 organizations. So like Akin has 7. We have a few organizations in the network that run 2 or 3 FRCs in the state of Washington. So we count those as FRC members, and then we have our organizations that are very active in advancing policy and learning to each other, and have really seen that growth in Washington. Next slide. Oh, go ahead, Brenda.
I had a question that came in real quick on this slide. Under your member services, the last one is the community strengthening activities. And we have a question from Carolyn, who would like to know, what are your community strengthening activities?
Oh, that's a great question, Carolyn. So I don't exactly know what we have bucketed underneath those. I'm imagining that they are activities around community engagement, engaging the community partnerships, connecting services and providers to each other so families have more of a wraparound support. I'm imagining that's what community strengthening activities are, but apologies if that's incorrect. The slide just, oh, thank you.
I can pull up, I believe that came in from our national inventory where we listed all the activities that were done, and you checked all of them. I was just trying to look, but I realized it went on the screen for everyone. I can get the full list of what those were before the end of this webinar.
Oh, thank you, Brenda. All righty. Well, next slide, please. So this, where we have seen real success, which has been really exciting, is funding for FRCs. So FRCs in Washington have predominantly been community based. So city, local, county dollars have supported FRCs. And then some of our FRCs do receive state funding through specific programs or federal funding. But we have been really fortunate in the advocacy of the network of securing $8 million over the last few years in flexible funding for FRCs. This is the first dedicated state funding for family resource centers. We took a very unique approach, as I mentioned earlier, where the funding was actually housed in the Department of Commerce. And there was a reason for that, is because in the state of Washington, our Department of Commerce has kind of become the home for community engagement, economic mobility, and importantly, anti-poverty efforts that really align with work that FRCs are doing. And so we have been able to champion FRCs in the Department of Commerce that have been more focused on supporting FRCs. And we had at least 30 to 35 plus FRCs that received that $8 million in funding in the last few years. The other investment that we were able to see, which was through the Department of Children, Youth, and Families, is they used their extra ARPA money, the CBCAP funds, to fund 9 FRCs over the last few years. That has been great, as well as supporting network development activities, sending some FRC staff around the state to some national conferences. And that has been really great that DCYF has been supportive in that space. We also sync preview. We're very early on in these conversations. We have also been working with the Department of Children, Youth, and Families as advancing FRCs, a part of our state's Family First Prevention Services Plan. Brenda mentioned Family First earlier. It is an opportunity of getting Title IV funding more upstream, and we're hopeful that we will be able to tap into FFPSA dollars to support FRCs in the state of Washington, and then use what we learn here to share with others around the country about what could that look like in other states and other jurisdictions. Next slide, please.
We have another question, Janica. That's
Oh, thank you. Sorry, I'm not monitoring the questions.
Well, it's related to this content. I thought we could have you answer it now. So Kakuna in Hawaii is interested if you could share your network staffing pattern and total budget to operate the network.
Yeah, so currently we just have one network director, and then there is a portion of my time as well as our public policy. We have a VP of public policy. We also pay for a state lobbyist that helps us with FRC advocacy activities. In addition, we have, our FRCs at Akin that participate in the network, but they're not fully dedicated in the budget. The current cost of the network with the network director role and advocacy and lobbying, I believe off of the top of my head, is about $350,000 a year. But that doesn't include, we also are trying to offer the national standards training, which I kind of view as separate, at least twice a year, for not just Akin FRCs, but the network as a whole of staff that want to participate in the national standards training. But just for the advocacy and network activities, specifically like the network director, it's about $350,000 a year.
And as a follow-up to Carolyn around the question about community strengthening activities, when we ask our members, do you provide any or all of the following activities? The activities included civic engagement, collaboration projects, initiatives, or coalition with other organizations to address community needs. So really being able to partner and collaborate with others to uplift the community and community needs is the key aspect of that piece.
Thank you, Brenda. So one thing I want to note is we, in addition to leading the work in Washington State, Akin has partnered with the NFSN in advancing what is known as the National FRC Coalition. And this is a little bit different than what NFSN does with around their advocacy and public policy, but they are a very much key partner in this work. The FRC Coalition was created 2 years ago to advocate for federal funding for family resource centers. Brenda mentioned a lot of different federal funding streams that FRCs are using around the country, but there is no dedicated funding for FRCs at the federal level. That is the work of the coalition. We are open to all, so individual FRCs, networks, as well as allies of FRCs and want to be supportive organizations. You are welcome to join. There is a monthly call where we review what is happening federally around child and family issues, as well as the work that we're advancing on a federal level for FRCs. So we have a QR code here if you want to snap a photo, and you can sign up on the website, and you'll get an email that has introductory information in joining the coalition. And I'm going to hand it over to Brenda on the advocacy side of the NFSN.
Yes, thank you so much, Janica. We greatly appreciate the work of the FRC Coalition in helping galvanize a movement towards securing dedicated federal funding. And it's been incredible to have such a close partnership to be able to really strategize behind the scenes and with our members and FRCs on how best to move that forward. So any ways that we can help advance work at this level and ideas that you have, we're always open to hearing them. This federal funding briefing image that you see here is one of the pieces that we gather and put out on a every other year basis to really try to help understand how to tap into those federal funding dollars. But having dedicated funding would be it's a dream that will come true. We're just trying to figure out the exact timeline of it. So thank you, Janica, for helping with your leadership there. And if you are interested in signing up for the NFSN email list, the QR code there is on the right. We have our next little segment for Q&A and then some additional resources that we wanted to make sure to share with you before we concluded today. So let me see here. I see we have one question yet that has not been answered. It comes in from Sid Gardner. If FRC's total budgets are 1 to 2% of total child welfare spending, very rough estimates on the data you've presented, and their savings are at the levels you've reviewed, where is the case being made about the need for a policy investment aimed at better child welfare outcomes? Can FRCs achieve scale with current resources, and can they be protected from the spending cuts? Who would like to jump into answering that first?
You know, it's partially a matter of strategic targeting. And at times when federal government hasn't been at its best, we've often found that some of the best innovations take place at the state and county level. And I think this is an experienced group on the call today. I think you all can point to, right, even in your career or your local examples of that. And we have found that it really, really pays off to be developing relationships with your state legislators and some of their analysts, if they have legislative analysts, so that the message that these are very good, sound investments, these keep families together, these keep government out of people's lives, the more intrusive forms of government. And it helps families connect with local community resources, both the voluntary sector, the faith-based sector, as well as the public sector. It really takes having a good, ideally a local messenger, but at times, I think Brenda has found herself appearing before state legislatures in other states. Casey Family Programs has Casey strategic consultants in all 50 states, along with the tribal agreements we have with 19 American Indian tribal nations. And we find that at times we have to have our local strategic consultant or one of our senior managers come out and speak to the legislatures to bring this kind of data and information to them so they understand the value of it. Because if no one's talking to them or talking to them on a regular basis, it's so easy to forget the value of these resources. And to Dr. Gunner's point, how modest of an investment this is in relation to the gains that you can have. So that's a few ideas, a few reflections. We've had some really great successes in talking with legislators recently, bringing out a nonpartisan, what do we know from science? What do we know from child development? What do we know from what works in a variety of states? And people seem very open to at least hearing that kind of a nonpartisan message.
Mhm, mhm. Yeah, and I
So,
want to emphasize what you just said, Peter. I think it really happens, like it's taken time with legislators and policymakers and government officials to understand the value of FRCs and how it connects to. I appreciate the conversation around child welfare outcomes. There's also other outcomes related to families as well, and how FRCs can play a role in that space. And I think it's just taken time and conversation and understanding the value of FRCs. I can speak particularly in the state of Washington, and how FRCs can play a role in solving some of these significant challenges. We are having some pretty significant challenges in the state of Washington around an issue that is very sensitive in child welfare. And our Department of Children, Youth, and Families is looking at, oh, how can FRCs provide a wraparound community for families that are constantly getting CPS calls and are constantly at that front end of that cycle? And how do we get them to community-based services and get them engaged so that cycle doesn't keep continuing? So I do want to emphasize that it really requires a jurisdiction localized focus and building those relationships and understanding how FRCs can be a value add in addressing some of these issues that like child welfare agencies have been experiencing.
I'm looking through the chat that we have some of the comments in the webinar chat here. Some of them are just updates of what's happening in California around them moving a legislative hearing on cost saving potentials of FRCs, which is fantastic to hear. Appreciate you sharing that. We don't have any other specific questions that have come in so far. But I have a few other resources to share that might elicit a few additional questions. So I'll move forward with that, and then we'll have a moment at the very end for any last ones that might come in. So this is a part of our Webinar Wednesday series. We have a plethora of recordings on Webinar Wednesdays related to FRCs and FRC networks and the field of family support, whether you're looking at supporting teen parents or unhoused populations, or helping grow state networks, or looking at how the standards of quality for family strengthening and support can help strengthen your work with families. Our Webinar Wednesdays cover a wide array of topics that hit at the heart of the work that we do. One of the Webinar Wednesdays that's next is on the 17th, and this is the overview of the standards of quality for family strengthening and support. It really dives into the question, what does it mean to be a quality family strengthening and support program? What are the tools to help you assess it and then build a pathway and a plan toward improving quality practice and building upon your foundational quality? The other one that I want to mention, and this came up in one of the chats, was the reference to us having a webinar in Q4 around blending and braiding federal funding streams and looking at Title IV-B and Title IV-E funds. So by this time tomorrow, when this recording will be on our website, you will be able to register for the webinar that will take place on November 5th. Is when we're having that webinar. And Chris Stoner-Mertz out of California, who's an expert in the space, recommended to us by Dr. Peter Pecora, will be presenting both on the federal funding streams, blending and braiding. We'll have an example out of San Francisco that's using really specific dollars to leverage FRC efforts there. And we'll have other states sharing the work that they're doing. So if you're interested in that topic, that will be taking place, a specialty webinar on November 5th. We also have a few upcoming trainings to put on your radar. Our Connect with Effect outreach training. This is happening in September. And this is really like, how do you do authentic, um, transparent community engagement with the communities that you're seeking to serve that are built upon the standards of quality for family strengthening and support? We also have our virtual standards training in October, our Parent Voices Matter. This is our PAC training, our Parent Advisory Committee training, really leveraging parent leadership to help give feedback, co-design, and be have a seat at the table in terms of the work that you're doing within your community and doing it with integrity. The other piece to note here that we'll also be talking about sustainability efforts in addition to fatherhood engagement and leadership engagement is our Fall Family Support Summit. And this builds upon the immense success of the Together for Families conference. Kaylin O'Connor, if you're still on here, you helped so much last year in launching an international conference for family support professionals. This was our way of doing something in this time where so much is needed to come together to build our, be reminded of our own resilience, to understand new strategies, and to double down in the areas that matter most. So our fall summit will be looking at father engagement, parent leadership, and program sustainability. And we will be having 3 sessions on sustainability, one around blending and braiding federal funding with Chris Donor-Mertz. We're having the community opportunity map team from Casey Family Programs come in and talk about how you can use their tool for grant writing and how to use it for program development. Plus, we'll be doing a special segment on all of our lessons learned on how to engage the business sector in supporting your FRCs and your family support programs. What are the strategies? What are the approaches? What are the messages? How do you build a win-win support and engagement in an authentic way from your local leaders, especially in a time where resources that we've had shortfalls and cutbacks. So how do we get really strategic to build a movement for the work that you're doing at the local level? So we invite you to take advantage of the early bird registration pricing. It only is for another 12 days, and to bring, your teams. We had, I think, one organization sent 27 people to the Family Support Summit out of Oklahoma when we had it earlier this fall, and it was for leaders in the space. So virtual summit, we invite you to attend and be a part of the national conversation. And here is our contact information. I'm going to go back to the Q&A real quick and the chat, but in case you wanted to reach out to Peter, Janica, or myself directly, you're welcome to use this here. So we do have a couple more things coming on in. We have Children's Trust Fund in Michigan. So it's in Michigan, we'll be using the ROI data for our advocacy with the legislator for the 2026 budget. It will be shared with the board of directors today so that they can think of ways to use it to impress those listening. Not supporting FRCs is unacceptable. Hear, hear. When we say we put children and families first, agree completely and very well said. Children's Trust Fund in Michigan, we appreciate you being here. It looks like we may have had one more question come in. Nope, that's the question from before. So final thoughts, Janica, Peter, and our 2 minutes remaining. Any last things that you'd like to say to all the folks who showed up today who are invested in FRCs and want to know how to make a difference and how to increase the impact?
I just want to emphasize, thanks, Brenda, that just keep talking about FRCs and keep advancing the conversation, because the more we talk about them within our communities, state, federal, it changes the conversation. And then to some of the questions we've got, then we see transitions with funding around that, especially in the public and potentially in the private space. So just hope what you heard today also makes you all champions of FRCs yourselves.
It's sometimes hard to take it all in one setting, and I particularly find the financial aspects of this can be a little intimidating. That's why I'm leaning in, and it's not on the website yet, but I will be one of the people registering for that session with Chris Stoner-Mertz, because she brings sort of a fresh perspective to this in a different way, and her slides have a way of unpacking some of the complexity. So it's a chance, if you want to have another shot at thinking about funding streams, to have the deck that we just went through handy with you, because Brenda's put in some excellent material in a very, very condensed way. Have that handy and tune into Chris Stoner-Mertz, because I think she will help us deepen all of our understanding in this area.
Yeah. Well said. And just appreciate all of you for showing up and being a part of this movement. Whatever role that you play, it is significant, it's important, and it's making a difference. And we appreciate you being a part of the National Family Support Network's Webinar Wednesdays. So looking forward to having you sign up for the next Webinar Wednesday, being a part of our mailer, and let us know how we can provide more meaningful content to you. So thank you all for being here. We appreciate you greatly.